I'm Saffron Cordery and I'm Deputy Chief Executive at NHS Providers. And first thing I want to say is I really hope that everyone has been enjoying their week of our Governance and Quality Conference. I'm really looking forward to today's conversation, and I'd really like to thank you for joining us for this session. So what we're going to be looking at today is encouraging a sense of psychological safety, focusing particularly on board leadership and role modelling. And what we're going to do is hear from 4 speakers who are going to focus on their experiences from different perspectives on what it means to create an environment where all staff feel safe and able to speak up candidly, where people can ask for help, they can share their concerns, and they can offer ideas and support to each other. One of the things that we know is fundamental to creating that sense of psychological safety is the culture of an organisation. And what we do know is that the board, its leadership, its style, how it works is fundamental in creating an effective culture for an organisation. So I think that it should be a really fascinating conversation, and I think particularly to hear these individual perspectives on how board leaders have created that psychological safety should give us a really good opportunity for discussion. So we've got 4 speakers today, as I mentioned. We've got Angela Hillery, who's Chief Executive at Northamptonshire Healthcare Foundation Trust and Leicester Partnership NHS Trust. We've got Caroline Alexander and Alistair Chesser, who are respectively Group Chief Nurse and Group Chief Medical Officer at Barts Health NHS Trust. And we've got Thea Stein, who's Chief Executive at Leeds Community Healthcare Trust. And they're each going to speak for around 10 minutes. And Alistair and Caroline will do a joint presentation. So I am now going to hand over to Angela Hillery, who's going to speak from her role as a Chief Executive and share what psychological safety means to her, why she specifically champions it, and how it relates within her trust to the wider quality and cultural challenges that she has faced and is likely to face into the future. So I'm going to hand over to you, Angela.
Thank you, Saffron. And it is really good to be with you all here today, because this is an area that I'm particularly passionate about. So it's great to get a chance to share with you some personal perspectives. I don't want to be here as the expert, but certainly I have some views on it, and certainly want to share some examples of ways in which we are doing this and approaching this across both of our organisations. So why does it matter? Well, I think it matters because it's fundamentally about how people feel at work, and their lived experience directly affects patient care, the safety culture, risk-taking, innovation, and so much more within the organisation. And I really believe that the extent to which an individual feels valued and included has a correlation with their psychological safety. Motivation's higher. In my experience, people go above and beyond if they feel that they have that in place. They're more likely to embrace change. Continual improvement is more a feature, not a resistance. Is a part of what I think are a healthy quality learning culture. And in our organisations, we say and genuinely believe that everyone is a leader, and it's part of everybody's job card to be on safety. And it doesn't matter what role you do, it's everybody. We need the eyes and ears of everyone for safety. But for people to do that, they need to feel safe themselves. They need to feel safe to speak up, raise concerns, challenge, healthy challenge, constructive of course, but challenge nevertheless, innovate and call issues out. And they can't do that and they feel safe, and they genuinely feel the organisation wants to listen to them. So personally, I believe it's about setting and creating conditions which are about the culture, and recognise it's an element that you will always be working on. So it's not a task. You can't tick a box and say, oh, we've done that, we've got the right things in place. It never finishes. And it has to be achieved in many different ways. And The examples that I'll give you today are just some of the ways in which we're doing it, but of course there's so much more. But it does include active listening, sharing stories, encouraging lived experiences to be shared as stories, but also people having the courage to speak up about them. It's about being uncomfortable. It's taking and accepting challenge, and it's most certainly about taking action. So let me share some examples and ways we're approaching it. I've chosen ones that hopefully illustrate not only actions, but also give you some insight into the board involvement in investment in time and resources as well. So in terms of our Freedom to Speak Up Guardian, this is not new. Everybody will have one, I'm sure. We're not different. But it's really clear to me, and has been in the organisations, that no one individual can do this role. Over time, we've realised that issues need to be much more spread out at scale across the organisation. And it was clear that our BAME staff in particular were not coming forward. And we could have rested on that. We could have said there's not issues, but we didn't. What we clearly did was then work with our BAME networks to extend our Freedom to Speak Up champions. And I'm pleased to say across our organisations, many champions now exist to support the Freedom to Speak Up. And as a result of that, in our BAME communities, our Freedom to Speak Up rose something like 200%. That's fantastic. That's progress as far as I'm concerned. I'm not at all worried about that. It's about the ability to create that safety to speak up. And people want to recognise themselves in being able to champion and feel safe. So that was really important to us. But just to give you an idea of some of the Speak Up works, obviously the Freedom to Speak Up individual is reporting to myself as Chief Exec. We have quarterly meetings with the Chair and the Senior Independent Director. We have board development every year. They complete the self-assessment so the board can do it. The exec team have reports and exchanges with the Freedom to Speak Up Guardian through our meetings. It comes through our quality governance. We have the Champions Forum that myself and the Senior Independent Director attend. So just one example. But let me share another around our staff networks. We have a range of them. Again, many trusts do. And during COVID, we used these for a lot of listening events. Execs, NEDs participated, and we listened and acted. We most certainly have increased our resources to our staff networks. We already had dedicated time for staff network leads, but we increased it, and COVID absolutely took increases even further. We resourced events for people to come together, to share their stories and to give confidence to do that. And we had some difficult and uncomfortable conversations, but it was building trust. And all of the networks have exec or NED sponsorship. I sponsor the BAME networks in both organisations, and in addition to the existing forums, I meet with those on a monthly basis to make sure that I can hear all of the issues that they have and are hearing and want to shape within the organisation. They also co-produce our plans, so that's our RES, our WDES plans. They are genuinely co-produced, they're determined together, and they come to the board to discuss those with us. But let me give you another example about action. So again, as many of you will have done, will have felt all very uncomfortable about the elements that came through from the George Floyd death in the USA. We clearly as an organisation felt uncomfortable, and I wrote out personally to all members of staff to declare our intention to be an anti-racist organisation. And of course, that is an important journey to embark upon. But we did more than that. We then held a series of workshops considering how we could become anti-racist organisations. What does it mean? What does it really look like? What challenges did we have? And what could we do quite differently? And we've now moved this into a programme of work across both organisations in our group structure. We've declared it as a priority because we know that people need to feel safe to talk about this very important area. And what we've done is we've actually defined what it means for us to be anti-racist. We've took stock of our journey in the equality, diversity, inclusion agenda. We've identified the actions we're doing, what we intend to do in our RES and other plans. We've got executive team learning. We've got race and cultural masterclasses. We've got trust board commitment and pledges, and we're sharing good practice. So actions, absolutely, because we know we've got a big journey to go upon. Another example is about training, because if you are clear about psychological safety, you need to recognise that training and education is also an important feature. So we do provide training. An example would be our in-depth training for staff around cultural intelligence and making sure that people understand that actually that is everybody's business. And again, we're now embarking in NHFT for some additional training of our senior staff on understanding racism at work, speaking up, speaking out, and taking action. We provide psychological support to our networks in terms of wellbeing focus, because we recognise that psychological safety impacts on people if they have fear and they don't feel that they're being listened to. So we also come at it from a health and wellbeing point of view. And of course, the board is also involved in those sessions. And as a board, we've embarked upon reverse mentoring and other initiatives to support that real sense of lived experience as an organisation. As part of our organisation's commitments, we also have sets of leadership behaviours, and I think these also help us to create the conditions for psychological safety, because we've co-produced those with our staff, and each one of us is appraised against those, and that's embedded into our ways of working. So very important. It doesn't matter who you are, that's important to demonstrate the leadership behaviours. And I also talk a lot about touch points with staff, because again, that creating that condition of trust is very important, and every interaction with staff clearly can add to that feeling of trust or take away from that feeling of trust. And it demonstrates value at every moment as well, which I fundamentally think is linked to this feeling of psychological safety. And if a staff member contacts me personally, I will always personally respond. If I'm going across a car park, I'll always make sure I reach out to talk to members of staff. That creates, not on its own, but it helps to create that feeling of you're important, we want to hear your views, and that value, as I've said. We've also have examples through our serious incidents. Obviously, these are very difficult incidents for any organisation, but it's very important to set the tone of safety and psychological safety for people to feel able to really lean into a no-blame culture. And part of that was a lot of time that we had to spend in terms of learning around SIs. I personally chaired those learning events and committees to demonstrate the real commitment to no blame and to really signal the need to trust and be open about learning together. And we've had service users, Health Watch, and other members of those communities join us in those serious incident review committees, and that's really helped us. And we've looked at human factors too, so that we can understand the importance. And I think that really has helped staff to understand the fact that actually this is a no blame situation and we all need to learn. But during COVID, we learned an awful lot. And we also learned that we hadn't got it right. The decisions weren't necessarily being taken with all the inclusion of the right individuals. So an example would be in our occupational health services. Through our listing events, we could see that we hadn't got the diversity in our occupational health team. So we changed that pretty quickly to make sure that people felt safe and the risk assessment could be reflective and shaped from them. Fundamentally, for me, psychological safety is about inclusion and value. And we bring our whole selves to work, and inclusive cultures recognise that psychological safety is key to this. And in a nutshell, for us, it has helped us in so many ways and continues to help us. And it's helped our culture in particular in terms of people feeling valued, our safety first approach, learning organisation and quality improvement, our EDI work, which of course is so important. And I think fundamentally helps us with retention and recruitment. And overall, our engagement has improved and fundamentally people are more motivated to work, which does, of course, as we know, affect the patient care. But finally, it's important to reflect that it does take time. You never finish it. It's not a one-off task, as I said initially, and the actions you take are being watched and they clearly need to be taken. And very often people will talk about it, but not act. And the time that you spend on it personally really matters from a board perspective. And the role modelling is really key. Thank you.
Thank you so much, Angela. And I think that was a really fantastic tour around your personal role in engendering psychological safety and the things that you're not only talking about but actually doing in your trust. And what I've particularly struck by is that sense of new initiatives, but also building on the structures that you have there to make sure that psychological safety comes through. Just before I move on to our next set of speakers, just want to encourage people to use the Q&A function. So if there's anything you want to ask Angela, please do feel free to put that in the Q&A now, because when all of our speakers have done their turn, we'll come to the dialogue and the Q&A session. So please do feel free to fire away with the questions. So next, we've heard from Angela as Chief Executive and her personal perspective on what she does in her organisation. We're now going to hear from a partnership of Caroline Alexander and Alistair Chesser, who are going to talk about the partnership of Chief Nurse and Medical Director and their perspectives and views on psychological safety, and particularly thinking about what that means for governance. So I'm going to hand over to Alistair and Caroline now for their presentation.
Thank you very much, Saffron. I'm Alistair Chesser, as you say. I'm Group Chief Medical Officer at Barts Health, and with me is Caroline Alexander, who's our Group Chief Nurse, and we do work in partnership, as I think and hope we might talk about in the next couple of minutes. We are going to focus our few minutes on the way in which our trust responded to the COVID challenge, starting about a year ago, obviously, and what we've learned about psychological safety through the last few months as a result. So Barts Health is a very large, next slide please, Barts Health is a very large acute trust. We run 5 hospitals with 3 big emergency departments within them. Upwards of 16,000 staff, about 100 wards, give or take, and everything done at scale. Next slide, please. This is essentially what happened to us during COVID, and then don't worry about the scales on the graphs, but you can see we had a big surge in admissions back in March, April 2020, and an even bigger one in December, January this year, mirroring what happened across the country. But we certainly took a significant hit. Next slide, please. The way we run ourselves is along the lines of a group model. Each of our hospitals has got an executive management team, which make decisions at hospital level. We've got a number of cross-cutting services, imaging and pathology being some clinical examples, HR and finance being others. And we've got a group HQ sitting overseeing all of this, supported by clinical boards, which are groups of senior clinicians who advise on strategy and quality. Next slide, please. So back in March 2020, like everyone, we were suddenly and quickly inundated really with COVID without much warning. And in terms of psychological safety, this was a massive challenge for us. It was a new disease, and it wasn't really at that stage understood very much at all, both in terms of its transmissibility, but also on how it should be managed and treated. So we were learning like everyone else as we went along. It was an upsetting disease because patients deteriorated and died unpredictably, often young and often very distressingly. We had real worries right across the trust about being overwhelmed, both in medicine and in ITU, and getting to a point where we just wouldn't be able to cope, and whether we would have to ration treatments and do other things which really hadn't come into our frame of reference in our careers before that. And probably most importantly, this was a very personal disease. We all had family members or friends or even us who picked it up, and there was a real sense that this was not just something which happened to our patients, but it was something that happened to us or could happen to us. And therefore a sense for staff that they were putting themselves potentially in personal danger. which is a new phenomenon for most people at work in the NHS. And it was important for us as an executive leadership team, as it is for all leaders, I think, to really understand how this felt and to show that we could empathise with how people were feeling on the wards as they worked. So what we needed was we needed a different governance structure from our usual. Our executive team normally meet once a week, our board meet once every 2 months in public, and yet we were having to make decisions every day. So very quickly we revamped the way in which our executive worked and all our hospital boards worked, and we kept on revamping it as time went by, adapting the structure to suit the function. And it became very clear, if it wasn't obvious already, that in times of crisis, people really want and need to be led, and to be led quite firmly. They need to be told what to do, and they need to feel that people are looking out for them and looking after them. So that was the challenge which we all collectively faced. There was an element of communicating down required. We got edicts, instructions, advice and data from NHS England, which all had to be assimilated, communicated down, right down to ward level. And they affected not just the modelling of what might happen next in terms of numbers, but also infection control guidelines, PPE guidelines, availability of kits such as ventilators and virology tests. So the communicating down was essential, but also the communicating up was probably more essential for us. And it was very clear that the closer one was to the patient, the more one understood about what was required in terms of leadership and decision making. People needed quick answers which were clear and which were actually addressing the questions they had rather than the ones which other people thought they might have. And the centre, both the centre of the trust, but also the centre of the NHS, was just not able to respond quickly enough to some of these challenges. And we were having to work ahead of national guidance out of necessity. We set up a thing called a clinical steering group, which Caroline and I both co-chaired. And this was a group of senior clinicians which met every 2 days during the crisis, and was set up to make decisions about clinical matters. We made decisions about things like how to consolidate patients on the ITUs, moving patients between the hospitals, about our use of NIV and where it would be done, how we managed the oxygen, which became a real worry at one stage, emergency department redirects, and staff moving between hospitals. And I think it wasn't so much that we had a group that did this, but what worked well for us was that this was a group which had really open borders. Anybody could dial in to a meeting. And we often had 50, 60, even 70 people dialing into one of these meetings, which were agendaed, but anybody could bring anything up in any other business and would get heard. And the hope was, and I think it was realised to some extent, that decision-making would be honest and transparent, and that all opinions would be heard, and that we could work through consensus. Because what Caroline and I knew was that we didn't have the answers to any of the questions we were being asked. All we could do was try to listen to the people in our own organisation who had the answers. And then finally, for me, the relationship with the board was an interesting one, because it became inverted to some extent. The strategy and the questions and the answers were all coming from clinicians and other people working at ground level. And the board's role really was to support, to challenge at times, to provide air cover, and to help us keep the big picture context. And we found ourselves briefing the board regularly, and the informal communications with non-execs was absolutely key, I think, to making sure that the board did not feel, or the non-executive members of the board did not feel detached from the risks we were holding, and also the way in which we were responding to them. So I'll just hand over to Caroline now, who's just going to talk about the other ways in which we connected or tried to connect with our staff and showed commitment and understanding as to what they were going through. Caroline, thanks.
Thank you, Alistair. Building on Alistair's point about the partnership that Alistair and I had, I just wanted to kind of illustrate the importance of psychological safety for us as directors as well, because if we're going to be role models, it's very, very difficult to do that if you're not feeling psychologically safe yourself. And I think one of the things that I think Alistair and I were able to illustrate was we were a team. Neither of us knew, like Alistair said, the right answer to any of this. And we also shared collectively our portfolio so that we were able to support each other in the best way possible. And we worked with our teams, our collective corporate teams, to create a huddle to problem solve collectively and do it. And that created a sort of an environment of safety, I think, for us in the decision making we're making. Because I don't think anyone in those roles through the pandemic at a director level could not go through it without feeling anxious at any one point. I think also just to pull out that way of working also helped to break down tribal boundaries that may happen in situations, you know, doctors, nurses or whatever. We were really able to do the right thing at the right time with colleagues. The second point I just wanted to illustrate was the visible leadership element, but visible leadership with purpose. And Alistair talked about the fact that we all need to listen if we're going to create the right environments. And one of the things I found really helpful in the pandemic was the ability to be as visible as possible because of Teams. I know I never thought I would say it, but it created a space for me where I could be anywhere and I could be talking to anyone, either on Teams. Actually, if you move to the next slide, that would be great. Problem solve on Teams, but also be out on the wards in between meetings doing strategy. So in my career, it was probably the best time I've had for being able to be visible and collect and connected. But I say visible with purpose. You know, when I was out there, when Alistair was out there, it was to test, always test, was the strategy we were putting in place making the difference we needed to make, and learning and responding and reprofiling what we were doing. And again, as I said, lots and lots of different ways of doing it. I'm going to pick on one example. Those nurses in the room will understand this. Some of the decisions we had to make about critical care staffing were probably some of the toughest of most directors of nursing careers and also nurse leaders in critical care. And what we did was have a session where we brought all the clinical leaders together across the organisation, and then weekly sessions with the nurses, where we collectively owned the fact that this was one of the hardest decisions people were going to have to make, and came together to make that decision and give people the safety that they weren't alone, they were covered, they had the full backup of the organisation. And the photo on the right-hand side shows the senior nurses showing at the end of it, actually they'd come out the other side in a very positive light. And I think we need to constantly think about how we engage when leaders are having to make some of the most challenging decisions in their careers, when they have to push boundaries. The other area is about thanking and celebrating. You cannot do it enough. People just glow when they feel they've made a difference. And I think we as leaders, to create psychological safety, people have to see that they are valued and that their contribution makes a difference. And I've never seen that more in my career than I have in the last year. And really just, I suppose, staff support's the other thing, and it's something that I'm proud that the NHS is taking seriously, that if we're going to do right by our patients, we must do right by our staff. And we've invested as an organisation in catching up on things we should have been doing before around environment, but also learning about how to engage more effectively, how to be better problems and solution focused, and making decisions more quickly. Because to be safe at work, you need to be working in the right environment with the blocks taken away. And we as leaders must create that environment, and we must break down some of the barriers to decision making. So really just my final points were listen, plan, communicate, thank, and make sure your decision making is dynamic, and make sure as individuals, as board directors, that you feel safe, that as part of your team you feel safe, and then you'll be able to do it. So thank you.
Thank you so much, Caroline. And I think you gave us a fantastic checklist there at the end. So that's really brilliant. I think this sense of listening, planning, communicating, thanking, dynamic decision making, and leaders need to feel psychologically safe as well as everyone else. So thank you so much for that. I'm going to move us on to our final speaker today. So I'm delighted to welcome Thea Stein, and she's going to talk specifically about the approach that Leeds has fostered to freedom to speak up, and talk about it in the sense of a practice rather than a position, and think about how the freedom to speak up perspective has helped respond to COVID. and think particularly around board ownership and leadership. So over to you, Thea, and as I said, we'll take questions from the virtual floor after Thea's presentation. So over to you.
Hadn't unmuted myself. Thanks for that. I will talk about the freedom to speak up role. And what I'm going to be talking about is really how that works within the context of an organisation that has for some years been on a journey towards being what I call emotionally intelligent and psychologically literate, which is similar, obviously, to psychological safety. So quite a lot of similarities to the other speakers as well in both the lessons learned and the issues that have to be in place to be where you want to be. But for us, as Saffron said, the freedom to speak up guardian role became very quickly very clear to us that it wasn't a role. And as Angela said as well, it was a culture and it was a practice. And the way in which we needed to embed that work would be around it being everyone's role. And it's everybody's responsibility to listen twice as much as you speak, to be there for people and to create that sense of speaking up and speaking out being commonplace, being something we all do and something that is a safe practice in all aspects of it. So how do you do that? And I absolutely come here, as others do, as a chief exec and as part of an organisation that, sort of Oprah Winfrey would say, is on a journey, not somebody who has arrived at the destination. And we're always in the process of discovery, and some of what we do hasn't been by design, it has been by discovery. But as I pick back and look at why have we been able to an extent, create that freedom to speak up practice rather than role, it comes from other things that we've had in place and are working on having in place over some years. The start of that is this emotionally intelligent organisation that can have a conversation about its feelings. It can have a conversation with each other about how things are impacting on it, on individuals, on teams, and that is an okay and safe thing to do. To teach people how to have difficult conversations and indeed how to have emotionally open conversations is really complicated. And it's something that you can both train and teach, but you also have to constantly model. As Angela says, I think it's really clear that every member of the board and every member, particularly of the exec, is under watchfulness, that you're really doing this, you're walking the walk, you're talking the talk, you're being the values you say are important. And that if you're not, that you're always going to be open to say you're sorry and you've got something wrong. That you are very clear there is never a witch hunt, that you are really clear that you will see a whole person and a whole situation, and that you model in everything you do that openness and inclusiveness and what I would call a psychologically informed approach. And that one of the planks of this has undoubtedly been, again, similar to other speakers, the way in which we've approached diversity and inclusion, which became turbocharged during the last year and during COVID. We all learned how much more we could do in terms of inclusion, and particularly working with our race equality network. Again, we have now embedded champions working with the Guardian around our race equality issues. And again, like Angela, we've seen an increase in people coming forward and saying issues they don't feel psychologically safe about. District nurses who quite understandably don't want to go and knock on the door of a house that they can see is festooned in a way that makes it a very dangerous and difficult place for them to be. But they want to know 100% that this organisation has got their back. And this organisation has zero tolerance for racist, homophobic, sexist, transphobic conversations. And increasingly the organisation feels that and knows that. And that's something that comes through action and taking action, which they can articulate that we have done and that we continue to do. The other very practical way in which the sense of psychological safety becomes embedded in an organisation is through the very, what could seem a very particular practice, which is the way in which you create policies and the way in which you apply your policies. We talk about two things. One of the things which is maybe a little bit clumsy, we talk about being an organisation of adults. It's a phrase I started using once and somehow just got resonance and people caught hold of. We also always talk about the fact that we're an organisation that tries to put people before policy and people before process. And we did that and showed it in several ways. One of the ways in which we did it, which I was unaware would have such a major impact when we did it, is that we got rid of the dress code in the organisation, not the uniform policy, but the dress code. You'll probably find that most NHS organisations, if not all, because I haven't found another one, have a dress code for staff who are not uniform member of staff. And that could be anybody, it could be a health visitor, could be a psychologist, could be the chief exec. And we don't have one. We don't have anything. We have a uniform policy. And when we launched the fact that we didn't have one, because it just came up for renewal and we decided to get rid of it, it took quite a long time to get everybody to agree to get rid of it, I wrote a letter saying, basically, we're an organisation of adults, and I trust you know how to get dressed, and I trust you know how to be in a whole range of different situations. And if something happens, we'll just have a conversation about it. It had quite an impact on the way people felt, and it was curious and interesting. But more importantly, we looked at other policies. We looked at our bereavement policy. There's nothing that tells you in our bereavement policy how long you should be grieving for anybody in particular. There are a lot of bereavement policies in the NHS that tells you that you have this much time if your mother dies, and you have this much time if your next door neighbour dies. And you have no time at all if your dog dies. Our policy is far more flexible, it's far more person-centred, it's far more nested on trust, but it also doesn't dictate from me and the board who you are and how you grieve. And again, those sorts of policies have impact. We did it again with special leave, we've done it again with carers leave, and we did a lot of supporting and open conversations throughout the pandemic, particularly with our staff who were shielding. We ran a group for our shielding staff every week during the pandemic, which is an open conversation. And that was supported by our Freedom to Speak Up Guardian and from somebody from our HR team. We ran a similar group for those people who were parents at home with children during the first lockdown, managing their work and managing their support to their children. We did the same for people who were either caring for older relatives who were with them in their houses, or people who were separated from those they cared for. We did a range of things with our Freedom to Speak Up Guardian and champions alongside to try and listen to hear those voices. In all of this, as other speakers have said, it's both the simplest of things to do and the hardest of things to do. It is everything you do every day. It's every policy you write. It's every touch point you take, as Angela described it. And through all of it, it's the authenticity, the consistency, and the personal honesty that you and every board member brings to this cultural change, which means that people really begin to trust that this is an organisation in which it is a psychologically safe place to be. I'll finish there. Thank you.
Thank you so much, Thea. And I think that's really interesting to hear those perspectives on how you're really embedding the concept of emotionally intelligent organisation or psychological safety through things like your policies and processes, which every organisation has. But it's really interesting to think about that very different perspective. But of course, structures in a sense really matter to support and underpin culture, and if they are at dissonance, I think with what you're trying to do with your culture, then you can't bring that in. So thank you to all of our speakers for really informative and thought-provoking presentations. Actually, as I said before, please do ask any questions you want to in the Q&A, and we will we will get the panel to answer them. In the meantime, I just want to probe a bit really on psychological safety in terms of the relationship in your executive board, because that's a really really fundamental relationship for the leadership of an organisation, but also for the culture of an organisation. And I just wonder if you could just explain how you create psychological safety, the relationship between the executive and the non-executives on your board. And I'm looking for a volunteer to go first. Otherwise, I will.
I'm happy to go first.
Thanks, okay. Angela.
So I think it's really important, and Caroline touched on the point about how the executive and the directors need to feel safe too. So I just will share a little bit in terms of some of the ways we've done that. Then I'll come on to talk a little bit about how we've done that across the board. So first and foremost, I mean, obviously through COVID, there was, as others have described, lots of decisive actions, lots of meetings taking place to manage it. What was really important as well was to have some informal time as an executive to actually just make sure that we're meeting together to think about us as people. And what we did through that, which I hope others would say helped, but it certainly, I think, helped me, I hope it helped some of the team, was we talked about our well-being. And that was hard initially because I think, again, people automatically think everybody can share their story and have the courage to do so, but it's just as hard for exec teams as any others. But we did it every week, and we rated ourselves every week, and we got used to doing it, and we got used to sharing what was impacting on us, whether it was at home or at work. I think over time that did create a real sense of our whole selves in the moment, but also that trust amongst us as a team. And then I think across the board, I think what we use, Saffron in particular, is board development time to actually, and that's continued throughout COVID in different ways, but we get together as boards to talk about different topics. We've obviously kept boards up to date through flash reports and all sorts of things, but that time to still connect has been important. So I think those are the sorts of things that have helped us. The executive feeling safe as a team to then go into that board discussion, I think has been important for us.
Thank you. Thea, can I bring you in?
Yeah, I mean, it'd be very similar that we spent time, I mean, obviously as an exec team, we spent a lot of time together, whether it was this way or in real life, dealing with the crisis over the last year. But we also always spend time together talking and supporting each other. 3 members of my team have young children, and we're juggling young children during this. That was also really helpful for the organisation to see that we had directors who had young children. We would have meetings, you know, with the medical director with her daughter on her knee. You know, it's become a bit of a cliche to say that, you know, never has it become more true that you bring your whole self to work. But never has it been more true than, you know, when a child breaks into a room and has a temper tantrum in the middle of a conversation about something really serious that you're trying to create at work. But it was real life. I met with the non-execs on behalf of the exec team. We agreed I met with the non-execs every single week from March. I met with them for an hour and just told them, because Alistair and Caroline said we made decisions, big decisions every single day, and you couldn't wait to write a report. So I was keeping them up to date and keeping them involved. And they also were very psychologically aware. I can't think of a meeting where at the end of going through the long list of things I need to tell you we have made decisions about, things that we have done and that will need to be sort of written down and go eventually into a board report, they would say, and how are you? And how are the team? And is everybody okay? And just those things are important, aren't they? And Alistair and Caroline said as well, we did a lot of celebration as well. You know, we did lots of sending things to people. Obviously, as a community trust, you know, we don't have a building that people are in. Most of our staff were always out in the field and out and around, so we developed interesting ways of doing it. But it's also, I did a meeting with with leaders across the trust, a drop-in meeting every single week. I still do it. Don't think we're probably ever going to stop now. And I would also talk about it being okay, about not being okay. When the weeks, I'm sure others did, weeks then I didn't know what to do and I didn't feel great.
Thank you. I'm just going to move us on. So the question has come in, which I think would be great for Alistair and Caroline to answer. Someone has asked, it's Geeta Patel has asked, interested in the breaking down of the tribal boundaries point, what can be taken forward from that for the future? And I think, you know, if our minds are focused on, we're still dealing with a pandemic, of course, but if we're also thinking about lessons for the future, and Thea mentioned, you know, there are things started through COVID that will continue and can't imagine not doing anymore. And I just wonder, in terms of tribal boundaries, perhaps if you could talk us through that and then think about, tell us how you're going to establish that, if you are, for the future.
I'm happy to start. So I think the thing that Alistair and I are trying to develop is what we're calling a co-directorate. So rather than being two divisions or two directorates in the organisation as leaders, that we're actually two leaders of a directorate of quality and clinical leadership. So that's our way of demonstrating to the organisation a partnership in decision making, which is an important leadership message. I think the other thing is that collective engage, it's valuing the different contributions people make to problem solving or to design. And what we've found is when you've involved the breadth of people in the decision making around service models or strategy, you get a solution that meets the workforce design, everything, and the patient's needs in a different way. So we're designing that type of engagement into how we work in our groups, in our clinical boards, but also particularly how Alistair and I are seen to role model as an organisation the value of all of those contributions, because that's critical.
Thank you, Caroline. Alistair, I don't know if you want to add in on that one.
Yeah, thank you. I think also alongside that, we're seeing the breaking down of professional boundaries in the NHS, with extended roles for nursing, physicians associates, therapists and pharmacists taking on more and more in ways in which they didn't used to do. And I think it's important for us as leaders in the NHS to embrace that, not to resist it, and to role model that, the way in which that does get embraced, so that whether you're a doctor or a nurse or a therapist or whatever you are, is really second order to what you can actually do and what you can bring to the party. And that came through in COVID, I think, because we increasingly just turned to the people who were the most effective at getting things done or helping to get things done. And it didn't really matter what colour their uniform was. In fact, it didn't matter at all. So we mustn't lose that, I think. And the direction of travel, I think, is for increasing breaking down of those professional boundaries. Thanks.
Thank you. And I wonder if I can just surface an issue that came up in the chat, which might be quite good for us to talk through, which I think I think it was in your presentation, Alistair, when you talked about, you know, there are, I suppose, different facets to psychological safety, and you obviously need different modes when you're in different situations. And there's that sense of trust and value, and empowerment, so people feel very much that sense of autonomy, which creates a real sense of psychological safety. But then there's also perhaps in a crisis situation that sense that we really need to feel that someone is in charge, in inverted commas, perhaps the wrong terminology, but there is that real kind of quite strong leadership. And I think that the challenge from the chat was surely that, you know, I'm paraphrasing massively here, so apologies to the person who put it in there, but, you know, surely that's disempowering and doesn't create psychological safety. So I just wonder perspectives on that. I mean, Alistair, I don't know if you want to come in first, and then I see others nodding, so I'll bring you in. But Alistair. Yeah.
So just to take a couple of examples from COVID, we had to move a load of doctors from some hospitals to other hospitals because we found our specialist doctors, their specialist work was ceasing, the elective work was stopping, while what was going on the medical wards was just overwhelming. So every hospital became a medical hospital. Someone had to coordinate that. It couldn't be done at ground level. And Another example, I think, is where we move patients between ITUs. We actually closed 2 of our hospitals to COVID admissions for a while because of the oxygen problems we had in those hospitals, and the capacity was reached in the ITUs. Again, that was made at group level because you can't make those decisions at ward level. So I think you've got to get a balance right. And the important thing is, when you're making decisions like this, is to try and make them having listened as carefully and as much as you possibly can before making the decisions, and trying to make sure that you bring people with you and make the decisions which they think are the right decisions, or will think are the right decisions. And on top of that, being prepared to change and to reverse it if it's not working. So there's a great deal of humility required, I think, in running these groups. Thanks.
Thank you. Angela, I wonder if you have a perspective on that.
Yes, and I think it's really interesting, isn't it? Because I'm a great believer in empowering staff and that distributed leadership, and that whole model is really something that I feel very strongly about. But there is no doubt Alistair's word is quite right. Balance was key. And, when you're running a gold incident, which is clearly what it was, daily and throughout the day, it actually needed that firm leadership, because people needed to feel safe that decisions were being taken and that the clinical leadership was informing that. And I genuinely feel people would have felt less safe if that hadn't been the case, because we couldn't take the decisions or take too long to make those decisions. People needed to know actions were going forward, and they needed to know that the right governance arrangements were in place to do that. And equally, as others have said, there was opportunity to shape and influence and listen, etc. within that. But on occasions, you do need to act differently. And I think that contributes as much to the safety in those situations as the empowering bit, which I feel very passionately about in the culture work.
Thank you. Thank you. That's really, I think it is a really interesting question, because it's about how in a leadership role you can flex, and that you've created the environment in which you can flex, because of course people need to understand different modes, and you need to engender a sense of that understanding of those different modes. I wonder if I could before I move on to another question, Caroline or Thea, do you want to come in on that?
All I was going to say, obviously I agree with what other people were saying, and I think it's what Alistair was saying. You have to make decisions. You're running a gold command. You make decisions, and sometimes you make decisions about moving staff. We made decisions about moving staff, or stopping services, or closing buildings. But it doesn't mean to say, because you're making those decisions, that you stop listening, and you keep listening, and you may have got something wrong, and then you make it right. So I think there's a real understanding that you're making decisions, but because hopefully you've got your psychologically open and inclusive culture, that people come and go, I understand why you did that, but X or Y. But also, really importantly, a constant dialogue, which we tried to have, about why we were making the decisions we were making. And, it's what Caroline was saying, having groups. And I never thought I'd be somebody who thought, gosh, this is a great way of talking to staff. I'm all for being in a room with people. But there were times when, I'd have 150 people on a call, and they'd be in cars, and they'd be in, their homes, and they'd be on a ward, and they were all hopped on the call, and we go, right, this is why we're doing this and this now. What do you think? And it was brilliant. It was the most inclusive way. So I don't think they're either or. They're an iteration between them all the time, in real time.
Thank you.
I would just add that that it's the skill of the communication and getting the messages out quickly, safely, and simply, but also that often these decisions have to be interpreted locally and that's where also people have the engagement to how they make it work. The final point I would say is, what we saw a lot in the pandemic was, we didn't always get it right in the first wave by a long shot, but by the time wave 2 came, the staff were saying the difference they saw, and that the engagement they saw by the change, because we'd learned from it each time, and you've just got to keep going back and looking, would be my advice.
Thank you. We're nearly at the end of the session, but I'm just going to do one of those horrible questions that I hate answering, but I'm afraid I'm going to ask it. So if you had to give one, what's the most important bit for psychological safety for you? What is your one takeaway from this that you would share with the people listening in on this call? And I will go in reverse order of the people who've just spoken. So Caroline, for you. Sorry.
I think with experience, I would say if you don't feel psychologically safe, you cannot enable your staff to be. And if that's coming from a director or a leader at any level, you have got to be psychologically safe yourself to lead or feel that way.
Thank you. Thea.
I mean, I would agree with that, but I think it's about being endlessly, relentlessly consistent and authentic about it. If you personally don't believe it, if you really don't believe that psychological safety is at the heart of a great organisation, you're not going to do it. You're not going to do it, and you're not going to lead it, and you're going to forget every second Thursday. You've got to do it consistently, relentlessly, and from your heart. I mean it.
Thank you. Alistair.
I think if I have one thing, it would be to go to where people are working, where they work, not where you work, and listen one-to-one or one-to-small group to what they have to say, and listen for the subtle cues, because most people don't shout if they don't feel safe. Most people get on with the job and do their best, but by having one's antennae finely tuned, I think one can learn a lot.
Thank you. And sorry, Angela, to leave you till last, but you started, so I'm going to let you finish.
Yeah. So for me, it's about that active listening to lived experiences, you know, making sure that those stories are coming through, and if they're not coming through, you're seeking them out.
Thank you. Well, I just want to thank all of our panelists, so Caroline, Thea, Angela and Alistair, because I think that's been a great conversation around all of the different facets of psychological safety, leading in an emotionally intelligent way, and really grappling with psychological safety in the most of extreme of environments. And I feel like if we took away the key points from today's conversation, we would have a fantastic manifesto for psychological safety. So I think I might make that my personal task to go away and do that. But it's been a great conversation, and I really want to thank you all so much, because I found it fascinating. I hope everyone who has tuned in today found it fascinating, and thank you all for your time and for contributing to our conference. Thank you so much.